Hi everyone. My presentation, my story we're sharing, I titled it Let It Snow and Weathering Changes in Research Plan. So I'm really enjoying my research, but I encountered a very unexpected barrier. So my take-home message is you might plan for everything that could go wrong and have little setups, but you can't control the weather. Okay, the title of my research was Assessing Physicians' Perceptions and Motivation for Facilitating Behavior Change Among Patients After a Brief Training in Motivational Interviewing via Coactive Life Coaching Tools. So I'll explain that a little bit more. As everyone knows, lifestyle factors play a huge role in our health: diabetes, obesity, cancer, heart disease. So lifestyle and behavior are huge. Yet, we know that physician counseling and even healthcare practitioner counseling is actually really low in this area. With smoking, with obesity, they just don't even bring it up, or if they do, they don't really effectively counsel some behavior changes to make. And some of the reasons for this are low perceived competence that they can counsel these behavior changes effectively, and that they perceive they don't have all the tools or the training to do this. So the rationale behind my research is that motivational interviewing is a really interesting approach to behavior change, and it's been really effective in a healthcare setting. So what it is, it's a technique, a behavior change technique that was designed to resolve ambivalence around a behavior change, and it was developed for addictions originally, so drinking problems, even smoking. And then coactive life coaching is another behavior change method that has been proven pretty successful. And what we found is the coactive life coaching provides the practical tools to bring some of the tenets of motivational interviewing into practice. And one of the main problems with motivational interviewing is that it has these great principles, but there's no practical way of, okay, so what do I do when I'm in front of someone? I understand what it's about, but what do I do? So we wanted to bring these two things together and provide practical ways for people to use motivational interviewing in clinical practice. And so we had a 8-hour training workshop designed to use motivational interviewing via these coaching tools. And the measures were include self-report questionnaires both before and after the intervention, as well as qualitative interviews. And hopefully that this workshop would be perceived as useful, and that there would be an improvement in the practitioner competence, confidence, and motivation to engage in these behavior change conversations. So I had 5 physicians recruited for this study. All my baseline interviews and questionnaires were done. I was so excited. And the workshop date and location was set for December 7th and 8th in Clinton, Ontario, which is about an hour down north of London on Highway 4. Okay, so this is what happened on December 7th and 8th. The snow was up to the parking meters. The roads, it was like Highway 4 was completely closed. And not only did it happen on December 7th, it happened on December 8th again. So the city was shut down. I don't know if you remember, the buses weren't running. It was, yeah, I felt like somebody was against me. So, yeah, and then not only that, so I thought maybe December 7th, maybe we can fit it all in one day, maybe everything's going to be okay. The next day, just as bad. That's, I think someone's car. So, and not only that, then there was complications in rescheduling, so I'm calling these physicians, but they share on call, so you can't really get them all for 2 nights again. And it wouldn't have been for months later. So I decided to re-recruit. So I remember being on the phone with my advisor, you know, almost in tears, like, oh my God, what is happening? But she was absolutely wonderful. We came up with a plan. And that brings me to my message, really, about being flexible in research. You cannot plan for anything. So with my advisor, I worked out that we would reopen recruitment and get all new participants. And it was scary, but it ended up being for the best. So looking to now family healthcare practitioners, and including pharmacists, dietitians, registered nurses, and scheduling the workshop location within London, and having the participants in London as well, just in case. So I just want to talk to you now. Now, that was in December, and now it's February. So we've actually done the workshop with the participants. Everyone came. I now have 10 participants, so I'm actually really excited about that. And the broader range of healthcare practitioners is really exciting to me. I have, pharmacists, dietitians, so they have a lot more interaction with the counseling now that I've looked at the literature again, because they actually have a lot more time to deal with it. So physicians often refer behavior change to these practitioners, so it's really exciting. And I've done some preliminary post-workshop measures, and already we can see that the perceived competence of the practitioners is actually increased, and also the perceived usefulness of the workshop and their motivation as well. So in the qualitative interviews, they talk about, now it seems easier, or now I'm actually a lot more motivated to tackle those non-compliant patients, because now I have some practical tools that I can try out with them. So they're really excited, and there's some more follow-up to come. So my message is basically just let it snow. Don't worry so much about your research. No matter what you plan out, not necessarily going to go as planned. And that all is not lost if something goes wrong. My research is still on track. I have 10 participants now, so I'm actually really excited about it. And just enjoy your research experience and the learning opportunities that come from it.